In this video, entitled Laboratory Skills Part 2, we will explore the important world of working in a veterinary hospital laboratory. In this program, we will explore the following topics: the use of a refractometer, the proper handling of aspirates and biopsies, basic staining techniques, collection and culturing of fungi and bacteria, and collection and identification of common external parasites for microscopic examination. Let's begin with the refractometer and its use. A refractometer is an instrument used to measure specific gravity or protein concentrations in various fluid samples. A specific gravity is a measurement of the density of a fluid as compared to distilled water. This is often an important piece of diagnostic information when evaluating a urine sample. Begin by placing a drop of urine onto the window, as seen here. Close the cover window and read the results with the refractometer in a horizontal position. Adjust the focus until a clearly defined horizontal line appears. Read the value printed on the specific gravity scale. This number represents the specific gravity of the urine sample being tested. Clean both windows with distilled water and non-scratching tissues before returning the instrument to its protective case. Normal urine concentrations range between 1.020 and 1.045. Protein concentrations are often measured by evaluating a drop of serum from the plasma portion of blood in a hematocrit tube. This protein value gives the clinician significant information in helping to determine the patient's hydration or other disease conditions. Hydration is measured in a very similar manner as specific gravity. The blood sample collected in a hematocrit tube is spun down in a microcentrifuge. The plasma portion is the clear fluid remaining above the red blood cells. After the packed cell volume is read and recorded, we are ready to evaluate the protein concentration. The outside of the tube is cleaned with tissue to remove possible blood contamination. The tube is positioned between your fingers just above the point where the blood cells stop and the plasma begins. With gentle pressure, snap the tube in half. The portion containing the blood cells can be discarded into a Sharps container. A drop of plasma can now be lightly tapped out onto the refractometer window and evaluated in a similar fashion. The protein concentration is read on a scale adjacent to the specific gravity. Normal total protein values for blood range between 5.4 to 7.5. Any discoloration of the plasma or serum should be noted as well, as this may prove to be of value in making a clinical diagnosis. Cytology is the microscopic study of cells. To enhance their visibility under the microscope, a specimen is often stained. Before staining can be addressed, we must properly prepare the sample to be stained and evaluated. We will discuss the preparation of three types of specimens: a fluid aspirated from a mass or body tissue, an impression smear made from a biopsied piece of tissue, and a blood smear. Preparing these specimens properly is absolutely essential in order for accurate results to be obtained. It is therefore very important that you handle the sample with great care and follow closely the instructions. Fine needle aspirates are commonly used to obtain a small fluid or tissue sample from a particular mass or organ. A 12 cc syringe and a small gauge needle are used to aspirate the sample. Several pulls of the plunger create a sufficient vacuum so as to pull a small amount of fluid into the needle and possibly into the syringe. Most fine needle aspirates will produce a minimal amount of fluid, oftentimes not even visible in the syringe. The needle is withdrawn while no vacuum is present. If minimal fluid is visible, assume there is a small amount trapped in the needle. This can be expelled by removing the needle from the syringe, placing some air into the syringe, reattaching the needle, and forcing the air through the needle while it is directed at a clean glass microscope slide. If any fluid or tissue is deposited onto the glass slide, it can be equally spread out by doing a pull smear. This is accomplished by placing a second clean slide on top of the sample and sliding them apart as demonstrated here. Both slides now can be further prepared for analysis. Proper labeling with a wax pencil or non-erasable marker should not be overlooked. In order to get the tissue sample to adhere to the slide should be dried and heat fixed prior to staining. Air drying or a hot air dryer work well and will dry most samples within minutes. Passing a slide, specimen side up, over a small flame several times creates enough heat to heat fix the sample to the slide. The slide should feel relatively warm, but should not feel so hot as to be uncomfortable to the touch. Too much heat will ruin the sample. Impression smears are another means of getting the suspect cells onto a microscope slide. This technique is commonly used when cytology of a surgically excised mass is needed. A fresh cut surface of the mass is generally preferred. This surface should be first blotted lightly with a paper towel to absorb blood and other fluids. The surface is then lightly pressed against the slide several times, causing cells to be deposited onto the slide. The sample can then be dried, fixed, and stained. A blood smear may be made by placing a drop of well-mixed whole blood at one end of a clean glass slide. The drop of blood can be taken off the rubber stopper, as demonstrated. With another clean slide, back the edge into the drop, allowing it to spread along the edge. Immediately after this has occurred, push the slide forward. This will evenly distribute the blood. The angle and speed which the slide is pushed are very important variables in creating a readable smear. A good smear will result in a curved, feathered edge with even blood distribution. After a second slide is made, the slides are set aside to dry. They can be fixed and stained after drying, or can be sent to a commercial laboratory for assessment. Regardless of how slides are prepared, when shipping them, always send them in a slide case, such as the one shown here.